Hello everyone. Today I will present you the synergy between Api-Phyto-Aromatherapy in the prevention and treatment of different diseases. My name is Ladislav Rosenberg. I represent the Romanian Society for Epitherapy, Phytotherapy, and Aromatherapy, and International Federation of Epitherapy. Some words about me, about the author of this presentation. I have carried out 50 years of scientific, educational, and practical activity in the fields of different integrative medicine like phytotherapy, aromatherapy, epitherapy, and homeopathy. I am honorary member of the Romanian Society of Epitherapy, Phytotherapy, and Aromatherapy, and the Romanian Society for the History of Pharmacy. And in the last period, I collaborate very well with International Federation of Epitherapy. Over the years, I have had the privilege, really a privilege, to collaborate with two important medical and pharmaceutical universities of Romania, University of Medicine and Pharmacy of Târgu Mureș, and the University Lucian Blaga of Sibiu, contributing to the formation, to the training of many generation of professionals. A question which I pose in the introduction of my presentation is Api-Phyto-Aromatherapy, APA, a new science and a therapeutic method. The synergistic integration of these traditional natural therapies utilized from millennia, epitherapy, phytotherapy, and aromatherapy, called Api-Phyto-Aromatherapy, APA, represents a new approach in preventive and therapeutic medicine. Very important to mention in prevention medicine, this synergistic association between these three traditional natural therapies is very, very important in my opinion. This interdisciplinary field, APA, which combines three integrative modalities of natural medicine, each offering unique bioactive compounds and very important good therapeutic activity and mechanism. Natural therapies, including epitherapy, phytotherapy, and aromatherapy, have demonstrated during the time significant potential in disease prevention and in disease treatment, in disease management. We see here the mechanism, the anti-inflammatory activity of bee venom by melittin, the most important active compounds of this important epitherapeutic product. The bioactive compounds present in bee products, like bee venom, which I mentioned before, medicinal plants and essential oils exhibit immunomodulatory, antimicrobial, and anti-inflammatory properties. This study explores the synergy of these therapies analyzing their mechanism of action and clinical application in immune modulation, infection control, and neurological health. Current scientific evidence suggests that their combination, the combination of this of epitherapeutic, phytotherapeutic, and aromatherapeutic products enhance therapeutic efficacy, reducing inflammation, improving cognitive function, and addressing antibiotic resistance. Natural medicine, we know very well, has gained increasing attention in recent years, in recent decades, due to the growing concern regarding antibiotic resistance, chronic inflammation, which is present in numerous diseases, and the side effects of synthetic drugs. Among natural approaches, apitherapy, phytotherapy, and aromatherapy, this triple synergy stand out due to their rich bioactive compounds. While individually effective, their combination may offer enhanced, better, high added value therapeutic benefits. Each of these three therapies contributing to APA, to Api-Phyto-Aromatherapy, is supported by extensive literature, very serious scientific literature, documented pharmacological properties, and their therapeutic effects. Combining these therapies within APA is proposed to provide a more comprehensive therapeutic approach, given the complementary bioactive profiles and mechanisms of action involved. Some words about epitherapy, which involves the use of bee products, bee-derived products such as honey, propolis, royal jelly, pollen, bee bread, and bee venom. These products, these high-quality natural products, are rich in flavonoids, phenolic acids, and peptides with antimicrobial, antioxidant, and anti-inflammatory properties. We see here the good effects, the therapeutic, really good therapeutic effect of propolis extract in the treatment, for the treatment of wounds. Propolis is probably one of the most important natural products, and studies have shown that propolis inhibits bacterial biofilm formation and enhance immune response. Phytotherapy includes a wide range of botanical treatments, a wide range of medicinal and aromatic plants with good therapeutic effects that possess diverse bioactive compounds like glycosides, alkaloids, flavonoids, bitter substances, vitamins, tannins, and so on, each with unique therapeutic actions, therapeutic effects. Phytotherapeutic applications in preventive and curative medicine are very well documented, with evidence, scientific evidence, supporting their efficacy in conditions ranging for example, for cardiovascular disease, type 2 diabetes, gastrointestinal disease, respiratory disease, and so on and so on. Aromatherapy uses these essential oils, highly concentrated plant extracts with potent pharmacological activities, including anxiolytic, antimicrobial, and anti-inflammatory properties. Essential oils demonstrate favorable effects on the central nervous system at the level of limbic system, being relevant in both psychological and physiological conditions, and also in somatic conditions. For example, lavender essential oil, which is probably one of the most used essential oil worldwide, has been shown to reduce anxiety and improve sleep quality through its interaction with central nervous system, with the limbic system. The combination of apitherapy, phytotherapy, and aromatherapy enhance immune response modulation. I mentioned now a combination between propolis and curcumin. Propolis, very important epitherapeutic product, and curcumin, the active substance of curcuma longa, an important medicinal plant, and a very important spice utilized in gastronomy, not only in the of Asia, but today utilized worldwide. This association, this synergy between propolis extract and curcumin reduce pro-inflammatory cytokines, elevating conditions such as rheumatoid arthritis and inflammatory bowel disease. Two diseases very difficult to treat in our modern medicine conditions. But propolis and curcumin synergistically reduce the inflammation specific for this disease. Here are image with propolis, this important raw material of obtained from the bee hives, and which is possible to transform in tincture and after in extracts, standardized extracts with very good therapeutic effects. And curcumin, which I mentioned, is the most important active substance of curcuma longa. Another association, synergic association, is between propolis and thisriol. This will be an association between an epitherapeutic product and a very important essential oil, an aromatherapeutic product. This association acts synergistically to inhibit bacterial biofilm formation, enhancing the efficacy of conventional antibiotics against resistant pathogens, against resistant bacteria. This makes this association makes aromatherapy a promising adjunct, a promising therapy, natural therapy in combating antimicrobial resistance. I represented here in these slides these two important products, propolis and Melaleuca alternifolia, from where we have the possibility to obtain by distillation T-threol, this very good, very important essential oil. Flavonoid-rich extracts from Ginkgo biloba, one of the most utilized medicinal plant worldwide, combined with royal jelly, a very good, very important apitherapeutic product, support cognitive function and delay neurodegeneration specific in Alzheimer's disease. This is very important because it is possible to utilize in prevention of Alzheimer's disease. And modern medicine don't offer a lot of possibilities for the treatment of this disease, Alzheimer's disease. Additionally, the anxiolytic effects of lavender essential oil, when used alongside honey-based therapies, suggest potential benefits in managing stress-related disorders. Here in this slide, we see royal jelly, this really very important product, epitherapeutic product, and Ginkgo biloba, one of the most utilized medicinal plants in modern medicine. Oh, I want to mention some product association between in this field of Api-Phyto-Aromatherapy, which are utilized during my practice. An excellent association is between a good quality propolis extract with T3 oil and marigold extract obtained from Calendula officinalis flowers for the treatment of wounds, for the treatment of burns and different skin infections. Another interesting combination is between Manuka honey. We know very well this is really one of the most representative product, epitherapeutic product of New Zealand, Manuka honey, oregano essential oil, and Echinacea angustifolia extract, useful in respiratory disease and a good immune stimulant. We know Manuka honey has potential antibacterial activity based on unique Manuka factor based on the active compound, which is methyl glyoxal, present in this honey, in Manuka honey. The association with oregano essential oil, which contains carvacrol, a phenolic compound with very good, with powerful, potent antimicrobial effects, and Echinacea angustifolia stimulate phagocytosis and interferon production. Yes, we obtain a good Api-Phyto-Aromatherapeutic products with immunostimulant effect. Another association is interesting association and util in therapy is between royal jelly and a well-known apitherapeutic product with milk thistle, Silybum marianum, and basil volatile oil. This synergic association helps reduce stress, fatigue, exhaustion and support a good hepatoprotective effect. We know that milk thistle Silybum marianum, which contains silimarin-like active substance in the seed caryopsis, reduces liver cell degradation, promote their regeneration, and has antioxidant and a very significant hepatoprotective effects. And finally, another association between pollen, apitherapeutic product, with peppermint essential oil, and spirulina, which is a good adjuvant in chronic fatigue. Pollen is rich in amino acids and trace elements and stimulates the central nervous system. Spirulina, a blue-green algae, is a good source of energy, of bioenergy, antioxidant, and a general tonic. If you remember, when I started this presentation, it was a question for my part. Is Api-Phyto-Therapy really a new science and a therapeutic method? After my opinion, yes. APA is really a new science and a natural therapeutic method with high potential in the prevention and treatment of different diseases. But to establish Api-Phyto-Aromatherapy as an independent scientific field, a new natural therapy, a standardized framework for research methodologies, clear clinical protocols, and regulatory guidelines is needed. Some conclusions. The synergistic integration of epitherapy, phytotherapy, and aromatherapy offers a promising complementary approach to disease management, to prevention of disease. Scientific evidence, supports their efficacy in reducing inflammation, enhancing immune responses, and combating microbial infection. Establishing standardized treatment protocols will facilitate the incorporation of these natural therapies of APA, of Api-Phyto-Aromatherapy, into mainstream medicine, offering sustainable alternatives for chronic, especially for chronic disease management. And finally, I want to say thank you very much for your kind attention, and thanks for the bees, which realize this fantastic synergy between epitherapy, between aromatherapy and phytotherapy. Thank you very, very much.